Hello, everyone, and thank you for attending today's webinar. This presentation was created by the Substance Use Topic Team as part of the Peer Health Educator Program at Queen's University. My name is Nadine, and I will be presenting with my fellow team members, Sydney and Kanav. Before we begin, I'd like to acknowledge that Queen's University is situated on traditional Anishinaabe and Haudenosaunee territory. I am currently living in Ottawa, which is located on unceded Algonquin Anishinaabe territory. And during the pandemic, I know a lot of other people are watching from different parts of Canada and possibly around the world. So I encourage you to look up and reflect on the origin of the land that you are currently on. Before we get started, let's put ourselves in the shoes of a first-year student going off to university for the first time. It's Frosh Week, and their social media is flooded with these kinds of pictures. How do you feel when you see these? Are you inclined to participate? Feel free to write this down and keep it in mind throughout the presentation. Substance use is a broad and complex topic, but today we are going to focus on substance use, specifically substance misuse, in the university setting. First, we will introduce some general definitions and terms associated with substance use before delving into three main topics. 1. Substance use in the university setting. 2. When substance use turns to misuse. And 3. Harm reduction strategies and interventions. By the end of this webinar, we hope to provide you with an understanding of substance use on campus, an ability to identify substance misuse, and harm reduction strategies to approach substance misuse. First, Sydney will introduce us to some general information and terms about substance use and health.
So what does health mean? The World Health Organization defines health as not just the absence of disease, but a state of complete physical, mental, and social well-being. This means that health encompasses a wide variety of dimensions in our life, such as our professional life or social life. Substance use and addiction are complex and multifaceted issues that can potentially interfere with one or more of these dimensions. Although frequently addiction is associated with some kind of substance, it is actually a broad term that describes any kind of compulsive, out-of-control behavior, such as gambling addiction or shopping addiction. However, for this presentation, we will focus on substance use. A substance is anything that can alter a person's mood or cognition, such as cocaine or cannabis. They are commonly used for recreational purposes, such as alcohol being enjoyed socially at a bar or restaurant. What do you think is the most commonly used substance in the world? The answer is caffeine. Recreational use can sometimes develop into drug misuse, which refers to substance use that is not consistent with legal or medical guidelines, such as overusing prescription drugs. But when does it actually become abuse? Let's talk about a scenario. You notice that your roommate has been going out to the bars more often over the last few months and coming back later at night. The days after drinking, you notice he will stay in bed all day and will call in sick to work and skip his lectures. He says his grades have been dropping recently too. Recently, he has started having a few drinks during the day to help him function. Do you think your roommate might have a substance use problem? What makes you think that way? Take a minute to think about what behaviors are giving you red flags. The following are substance use red flags that can be associated with the previous scenario. Chronic use, interference with daily tasks in life, cravings, potential dependence, problems at school and work, including frequently missing school, a sudden disinterest in school activities, or a drop in grades, physical health issues, including a lack of energy or motivation, weight loss or gain, and neglected appearance, and finally, changes in behavior and relationship with family and friends. As you can see from the previous scenario, harms from substance use can come about in different ways and at various levels of severity. For example, short-term issues with alcohol can be as simple as a mild hangover, but can escalate to dependence over a longer period of time. Youth specifically are a vulnerable population when it comes to drug use and addiction, and may actually be more susceptible to harms associated with drug use or abuse. Because brain development is still happening throughout adolescence, drug misuse or abuse at this point in life could interfere with academics, social life, professional life, and can increase the likelihood of developing a mental health disorder in adulthood. So how can we lessen the impact of substance abuse or misuse? Main efforts now are focused around harm reduction. What is harm reduction? Harm reduction is a system of policies and programs that aim to minimize negative consequences associated with drug use. Examples of it include safe injection sites or naloxone kits. Harm reduction focuses on positive change and on working with people without judgment, coercion, discrimination, or requiring that they stop using drugs as a precondition of support. It is very different from abstinence-focused interventions, which you may have been exposed to in primary and secondary schools, such as the Just Say No or DARE campaigns.
Substance use and binge drinking is often one of the first things that comes to mind when people think of socializing in university, especially with regards to events such as Frosh Week, Homecoming, or St. Patrick's Day. Substance misuse can lead to many adverse consequences, both short and long term, and it is important to create interventions that specifically target university students. Let's take a look at some of the reasons why substance misuse is such a prevalent issue amongst this demographic. Coming to university may be a time when students are experimenting more with different substances for many reasons, including reaching the legal age, which makes substances more accessible, living away from home for the first time and having more freedom, having closer contact or living with peers, which can lead to direct or indirect peer pressure, and dealing with new stressors associated with starting university. These factors have led to a significant culture of binge drinking and substance use amongst university students. Risky substance use has become normalized at many universities, including at Queen's. This is an issue because research has shown that normalization of such behaviors significantly increases substance misuse amongst young people. This occurs because students internalize substance misuse as a cultural norm in university. This increases their likeliness of misusing substances and suffering from related consequences themselves. Lots of research has also indicated that media displays of substance use increases the likeliness of use. This effect has become amplified in the past 10 to 15 years as a result of social media. These media displays, such as the ones in the pictures shown at the beginning of the presentation, tend to glorify substance use without addressing the importance of implementing safety measures to reduce potential harms or consequences associated with substance misuse. This chart summarizes some findings about binge drinking from the National College Health Assessment Survey, which was administered to Queen's students in 2019. As you can see, many harms have been reported by Queen's students as a result of binge drinking. Some of the most common ones being performing a regretful action, experiencing a loss of memory, having unprotected sex, and becoming physically injured. The NCHA also found that binge drinking was statistically more common at Queen's than at other Canadian universities. It is important to note that problematic substance use in university students goes beyond alcohol, marijuana, cocaine, and cigarettes. Other substances that can be misused may include MDMA or non-prescription study drugs or painkillers. How common do you think substance use is at Queen's? Feel free to pause and write down what percentage of Queen's students you think have used each of the substances listed on the table at least once within a 30-day time span prior to COVID-19. We will then compare it to the actual reported use. This column shows the average perceived use of these substances at least once within a 30-day time span. and this column shows the actual use within a 30-day time span. As you can see, there's a significant discrepancy between perceived and actual use of substances amongst Queen's students, especially for marijuana and cigarettes. This has important implications for health promotion strategies. For example, spreading factual information about the prevalence of substance use in Queen's students may help reduce the perceived normalization of substance use on campus. This could then lead to a reduction in substance misuse and associated consequences. Now, Canav will speak about harm reduction.
Now that we've discussed some harms related to substance use, we can learn how to reduce them. So first, let's start off by understanding what harm reduction is. Harm reduction is an evidence-based, person-centered approach that uses policies and practices that aim to reduce the health and social harms associated with substance use without requiring people who use substances from abstaining or stopping these substances. So what that means is harm reduction is centered around the person for whom we are trying to help. It also means that strategies we use need to have evidence for if they work or not. And most importantly, any strategy we use must help them without forcing them to stop using these substances. An essential component to harm reduction is that it provides people who use substances a choice of how they want to minimize harms via a non-judgmental and non-coercive approach, meaning that the approach is completely voluntary. This is done in order to help enhance skills and knowledge to live safer and healthier lives. The overarching goal of a harm reduction approach is to prevent the negative consequences of substance use and improve health.
Now that we know what harm reduction is, let's take a moment to think of some examples of how we practice harm reduction in our daily lives. Some examples of how we practice harm reduction in our daily lives include safe drug injection sites, needle exchange programs, using a nicotine patch instead of smoking, wearing a seatbelt, and wearing a mask. It is very important to understand that harm reduction and substance use happens on a continuum. People can fall anywhere on this continuum. One thing to note is that a person does not need to necessarily stay stagnant at one part of the continuum, and that they can freely move through it. Thus, when we perform an intervention, we must remember that not everyone will be in the same position regarding their substance use. Now, let's move on to specific harm reduction strategies. We will start with alcohol. These strategies include standardizing your drinks, alternating alcoholic drinks with water, eating food before drinking, pacing your drinks, setting limits for your alcohol consumption, and drinking in a safe environment. While knowing all these tips in isolation is great, let's try to actually incorporate them in a real situation. So, for example, let's say you have a party at your friend's house. You can set limits for your consumption by only bringing a certain amount of alcohol with you. A red Solo brand cup has lines which indicate standard drink size, as we can see on the slide, which help you keep track of how much you drink. Bringing a water bottle along with you would make it easy to alternate water with alcoholic drinks. Eating food before going out to your friend's house and drinking will help slow down the absorption of alcohol, increasing the time before it starts affecting you. Finally, having friends around you that you trust will help make sure you stay safe when going out. Now, let's talk about some harm reduction strategies for cannabis consumption. Be aware of the contents of your cannabis and your supplier, including THC and CBD and any other contents. Use other methods of ingestion, such as edibles or vaping, that are not as damaging to your lungs. Avoid inhaling deeply or holding your breath. Try to limit use as much as possible. Do not operate vehicles or other machinery while using cannabis. Consider your family history of mental illness, as cannabis can exacerbate or trigger episodes of mental illness such as psychosis. Avoid synthetic cannabis products.
Below are some scenarios that will help you practice applying harm reduction to your everyday life. After reading each scenario, pause the video for a moment and think about how you would approach this situation. The first scenario. You have a friend who insists on using opioids, but you are worried about an overdose. What can you suggest to minimize risks for your friend? Pause the video and think about what you can do here. Second scenario. Your friend is having a lot of trouble in school because they are going out multiple times a week and they can't do their work when they're hungover. What would you suggest to them? Once again, pause and think. For the final scenario, you are going to a Halloween party with your friends and you plan on drinking alcohol. What are some things you can do as an individual and as a group to make sure you're all staying as safe as possible? Now that you've had a chance to think about how you can apply harm reduction strategies to your daily life, let's move on to when substance use turns into substance misuse.
Many people enjoy using substances such as alcohol or marijuana in their free time. Low-risk use of substances in moderation is less likely to cause harms and can be an enjoyable thing for individuals to do in a social setting. However, misuse of these substances outside the boundaries of moderation can lead to negative consequences and possibly a substance use disorder. A substance use disorder is a very real disorder that has many negative effects on one's health and well-being. By being aware of the signs of this disorder, you can hold yourself accountable and possibly help a friend or family member who is struggling. Addiction to substances can be defined by the 4 C's. Craving, failing in attempts to stop using the drug, and experiencing withdrawal symptoms when you attempt to stop taking the drug. Control, loss of control of amount or frequency of use, taking larger amounts of the drug over a period of time than intended. Compulsion, compulsion to use, feeling that you must use the drug regularly, having intense urges for the drug that block out any other thoughts, spending a good deal of time getting the drug, using the drug, or recovering from the effects of the drug. Finally, consequences, not meeting obligations and responsibilities or cutting back on social or recreational activities because of drug use. Continuing to use the drug even though you know it's causing a problem in your life. Spending money on the drug even if you can't afford it. What are the harms associated with substance use? There are various harms associated with substance use, including both short-term and long-term effects. For example, physical harms include increased risk of disease. Emotional harms include triggering or worsening mental health conditions. And sexual harms include risk of STIs and unprotected sex. For university students, higher levels of alcohol consumed leads to greater risk of alcohol-related harms such as criminal and aggressive behavior, health and emotional harms, and sexual harms. Physical harms. Some long-term physical effects of repeated substance use include heart, liver, and kidney disease, cardiovascular problems, damaged respiratory system, weakened immune system, reduced sexual capacity and impotence in men, and changes in brain chemistry. Emotional harms include the increased risk of comorbidity, which is when 2 diseases occur together. Substance use and mental disorders frequently occur together, and interactions between these 2 disorders can worsen both. Sexual harms include the actions that are a result of substance use. These actions include unprotected and risky sex, and can lead to an increased risk of HIV and other STIs. Intersectional experiences faced by marginalized groups can contribute to the likelihood of experiencing problems with substance use. They also often have more barriers in terms of accessing support and resources. It is important to be aware of this broader issue when thinking about substance misuse, and to consider the following factors: low socioeconomic status, gender stigma, international students, and racial minorities. What to do in the case of an overdose. If you suspect someone of overdosing, call 911 immediately. If the person is passed out, they should be placed on their side just in case they vomit. This should help prevent any choking accidents should they occur. The person should also not eat or drink anything. If an opioid overdose is suspected, administer naloxone.
That brings us to the end of today's presentation. Referring back to the learning goals, We hope that today you gained an understanding of substance use on campus, an ability to identify substance misuse, and an understanding of harm reduction strategies to approach substance misuse. Feel free to follow us on social media, and please don't hesitate to contact us if you have any questions. Thank you for watching today's webinar. We really hope you enjoyed it.